Okay, you've heard all the warnings. Hormones cause cancer. Hormones are dangerous and you should just tough it out. Your mother did, and your grandmother did, and her mother before her. But you've heard all these warning signs. What if that's not the full story? In my last video, we talked about the different hormone delivery methods, but today I am breaking down the truth about bioidentical hormones, what the science really says, and what I tell my patients here at Vista Wellness. Hi, I'm Dr. Bennett, Doctor of Nursing Practice and founder of Vista Wellness in beautiful St. Augustine, Florida. I help my patients rebalance their hormones, ignite their energy, and just overall feel like themselves again with real science and personalized care. Again, with real science and personalized care. So this topic is one of the most misunderstood aspects of hormone replacement, and it's time that we clear the air. So let's begin by looking at the differences between bioidentical and synthetic hormones. Let's start with the word bioidentical. What does it actually mean? Bioidentical means that the molecule of the compound is identical to the hormones that your body naturally produces, like estrogen, progesterone, and testosterone. So bioidentical hormones are made from plant sources like soy and yam, and they are designed to fit perfectly into your body's hormone receptor like a key in a lock. Studies haven't shown that bioidentical hormones put you at higher risk of cancer or stroke. In fact, bioidentical hormones have been shown to improve several health conditions. Now, this is not the same for the synthetic hormones, and these hormones were mainly used in treatments like Premarin and Provera. But synthetic hormones have a chemical structure that is not similar to the natural hormone that your body produces, but they can mimic the function of hormones to help treat symptoms. The controversy of hormones started with the Women's Health Initiative study in 2002, which showed an increased risk of breast cancer and stroke in women who were treated with hormones. But here's the truth about that. That study used synthetic hormones, not bioidentical, and the participants were older, maybe an average age of about 63. And later analysis showed that the risks were misrepresented and misunderstood. So in fact, recent studies have shown that bioidentical hormones might be safer and even protective when used correctly. So what has recent studies shown us? According to peer-reviewed research, we are seeing that bioidentical progesterone has a lower risk of breast tissue stimulation compared to synthetic progestins. You also have bioidentical estradiol therapy that may reduce the risk of heart disease, Alzheimer's, and osteoporosis. We're also seeing that bioidentical testosterone has been shown to improve muscle mass, bone mineral density, thereby reducing the risk of osteoporosis as well. It also plays a really vital role in mental health and cognition. So overall, hormone therapy improves your quality of life, it improves your sleep, it improves mood, sexual health, skin elasticity, and much more. So it is not just entirely about risk or no risk. It is about balance, proper dosing, and really the person who is managing your care. Your practitioner needs to understand your body and understand how hormone therapy can help treat your symptoms. So what do we do here at Vista Wellness? I never use a cookie cutter approach when it comes to hormone replacement therapy because everybody is different. So I always start with comprehensive blood work, and we do blood work too as we go along to see how your body is adjusting to these hormones. We take a deeper dive into your symptoms. We look at your lifestyle, we look at your risk factors, and then we craft a custom plan that is meant just for you, your body, your goals, your lifestyle, right? So, and we monitor your progress again very closely, adjusting as needed, running labs when we need to run labs. We do labs a bit more frequently at the beginning, and then as things start to adjust and we know what works for your body, then the frequency might start to slow down, a little bit. So, real talk. No, you should not just suffer through it. You don't have to tough it out. And no, aging should not feel like you're falling apart, right? But yes, you deserve to feel whole, you deserve to feel sharp, you deserve to feel beautiful again. So bioidentical hormones, this is not just magic. It takes a little bit to kind of figure out what really works for you, but it is a powerful tool that when used responsibly, by a qualified practitioner as well who listens and customizes your care, it can really make the difference in your life and how you feel. So if you've been afraid of hormone therapy, let's talk. The right information really can change your life and how you feel every single day. Book your private hormone consultation here at Vista Wellness. We offer both in-person and telehealth options. Call us at 904-800-4003. Text at VistaWellnessFL.com. And please don't forget to like, subscribe, and comment. Share this video with someone you think really needs it. I'll see you in my next video.